Okay, next up is Emma Hartwig. She's going to talk to us about taboo topics in Parkinson's disease. So she's a physician assistant with our Cleveland Clinic Movement Disorder team for the past 2 years. She completed her undergraduate studies at St. Louis University and earned her Master of Science in Physician Assistant Studies from Case Western. Emma is especially passionate about patient education, which I can attest to, and empowering individuals to reach their personal health goals. Welcome, Emma.
Hi, everybody. Good morning. All right. I just want to say thank you so much for being here. This is one of my favorite things that our department does, and I'm so happy to see some familiar faces out in the crowd. So today, I'm going to talk about some taboo topics in Parkinson's disease, and you might wonder what we're going to be talking about, so I'll get to that. But why should we even talk about this? Because sometimes some of these topics can be uncomfortable. A lot of people don't realize that some of the symptoms they're experiencing are actually related to their Parkinson's disease. Sometimes, often when we think about Parkinson's disease, we might think about tremor, might think about slowing down, shuffling our feet. But there are a lot of other symptoms that Parkinson's disease causes that aren't so obvious. Maybe we don't see them, and our family and friends might not notice that we're struggling with them, but they can have a huge impact on our quality of life. So they are really important to talk about. Okay, so my goal today, I want to kind of make a comfortable space to talk about these things, and more importantly, I want you to feel comfortable talking to your healthcare provider about some of these things, because I don't know, sometimes you don't know if it's related to Parkinson's or not. You can ask us anytime. Nothing is off topic. Nothing is out of bounds. I just kind of talked about this slide. I probably should have clicked that sooner. An important point at the bottom of this slide is that it's important to realize not everybody is going to experience all the symptoms that I'm going to talk about, or any of them at all. Everybody is unique, and so just keep that in mind. I'm talking about some of the most common. Oh, let's try to get my green. Trying to advance my slide. One moment. Oh, there we go. Okay. So here are the topics for today. We are going to talk about depression and anxiety. We're going to talk about elimination issues, which include some bowel and bladder issues. We're going to talk about impulsive behaviors. We're going to talk about sexual dysfunction and hallucinations, because all of these things are very closely related to Parkinson's disease, and that might be a surprise for some of you. All right, so we are going to start out with depression and anxiety, and my slides are kind of broken up in a specific way. We're going to talk about, well, what is this topic? Why does this happen in relation to Parkinson's disease? And then we're going to talk about why it's important to talk about and some treatments. So hopefully, I can't fit everything into these slides, but this is just a conversation starter. So depression and anxiety, sometimes we have this idea in our head of what depression might look like, sitting and crying. No, actually, depression and anxiety can show up in a lot of different ways. So it might be just kind of a loss of interest in something that you really used to care about. It might be appetite disturbances, so you're eating more than you used to, or you're not eating as much, or you're sleeping more than you're used to, or you can't sleep at all. Of course, also fatigue, feelings of worthlessness or guilt, and these can become very severe. So why are we talking about depression and anxiety at a Parkinson's conference? Because these are highly associated with Parkinson's disease. And depression can impact around 30 to 40% of patients, and anxiety even more. Why does that happen? So there are a lot of reasons, technical reasons. Maybe Dr. Oken's book I haven't read it yet, I'm excited to, but might go into some more specifics. But the kind of baseline understanding is that we have a disruption in our brain chemicals, okay? So dopamine, as we all know, changes in serotonin levels, and also some structural changes in the brain. So people who have never experienced depression or anxiety in their life before might realize that some of those things are starting to come up for them, either before or after they get diagnosed. It's really important to talk about because this can lead to loss of hobbies. It can disrupt your relationship with your family and friends, and it can really decrease your quality of life. And there's no reason for that because we have some good treatment options. So just a few of our treatment options include Parkinson's counseling. We have some amazing counselors who work for us. They're psychologists who really understand how Parkinson's impacts your life specifically, and what we can do to regain some control, some hope. We also, for some people, they are really like support groups. That can be really beneficial when you're experiencing some of these symptoms and feelings. And then for the right patients, sometimes medication is needed. Sometimes medication is needed because, like I spoke about, we are having some chemical changes in our brain, and sometimes that needs to be addressed pharmacologically. Okay, next topic. Elimination issues. This is a big one. So we have some bowel and bladder issues that are very common with Parkinson's. So constipation is a big one. I'm not going to do this, but if I were to say show of hands, I bet a lot of you guys experience constipation. And that is really uncomfortable, okay? Multiple days between a bowel movement or just pain when you have a bowel movement. Additionally, one of the other really common elimination issues is urinary changes. So strong need to urinate, right away, not being able to hold your urine, or waking up a lot throughout the night to urinate. It should be said that there are other medical conditions that can, contribute to this, but it is associated with Parkinson's disease as well. This is really common. Like over half of people who have Parkinson's experience elimination issues. And why? The question is, well, why does that happen? There are a lot of reasons, but Parkinson's disease, it alters your brain-gut axis signaling, okay? It can cause the slowing of your gut, and it can also cause some issues with like dysfunction of sphincters, etc. So it can cause there are a lot of different reasons why these elimination issues happen in Parkinson's. Why should we talk about it? Why? Well, it can be really embarrassing for some people to constantly have to use the restroom. It can lead to discomfort. It might disrupt your sleep. And like I said, if we could avoid that, we should. And we do have some treatment options. They range from very simple to more complex, but dietary modifications, including increasing your fiber, your water. Some people need some kind of medication or over-the-counter medications for constipation. And then some prescription medications for urinary urgency. So there are a lot of options. And we would, please talk about with your provider about this if this is something you experience. Okay, my next slide is about impulsive behaviors. So what are we talking about when we're talking about impulsive behaviors? So these are reward-driven behaviors, and there can be a variety of ways this shows up. It might be that somebody starts gambling more, or gambling and they were never a gambler. Excessively shopping, spending money they don't have, binge eating, sexual behaviors, things that just kind of seem out of character. Maybe you went to the casino every now and then, but now you're going way more often. That should raise a red flag, and it is related, can be related to Parkinson's disease. So this can be closely associated with certain medications that we might use for Parkinson's. They can increase the risk of these behaviors. There are some medications that increase the risk more than others, but it's something that actually can be addressed frequently by some medication changes and also counseling. But reasons why we might want to talk about this is because this can have really significant social, occupational, financial consequences. This might feel embarrassing because it might feel out of character and you don't want to talk about it. But again, impulsive behaviors are something that are important to talk about with your healthcare provider. Okay, next slide is sexual dysfunction. This is a really big and common concern, but I oftentimes feel that my patients don't want to bring this up unless I bring it up first, and I completely understand that, but it's an important topic to talk about. So sexual dysfunction in Parkinson's oftentimes shows up in a few different ways. So people might have like a reduced sexual desire. They might experience erectile dysfunction, arousal difficulties. Less commonly, kind of going back to my other slide, people might experience some hypersexual behaviors that might be, out of character. Specifically with this issue, sexual dysfunction, this can occur in men and women and does occur in men and women with Parkinson's disease. Men are more likely to report this as an issue. And it's very common for women to experience decreased sexual desire or arousal difficulties. Like I said, this is extremely common. Why does this happen? So there are a few reasons. You can see from my presentation that there are a lot of different factors that impact each of these. But a few reasons are that Parkinson's can cause autonomic dysfunction, which can impact your blood flow and your arousal response. You have neurodegeneration of certain pathways, which can impact your sexual function. And this is important to talk about because if we don't talk about it, oftentimes people might feel depressed. They might experience worsening depression. They might experience some embarrassment or have a strain on their relationship and just feel like their quality of life is lower. And there are things we can do about that. So that's something to talk to your provider about. Oftentimes, education is really important as a treatment. Education, knowing that this is part of your condition. It's not just a problem that you're having that you need to feel embarrassed about. Counseling with your partner can be really helpful. That kind of goes in the same vein as education. And then there are some medications that might be helpful in terms of normalizing sexual function or assisting people with their intimacy with their partner. Okay, hallucinations. So people sometimes aren't exactly comfortable talking about hallucinations either because they wonder, oh my gosh, is my doctor going to think I'm crazy? What are they going to think? I feel embarrassed talking about this. So hallucinations are most frequently in Parkinson's, seeing things that aren't there, and sometimes hearing things as well. Oftentimes, people might start out by seeing kind of floaters or fuzzies. Maybe they think they see a dog or a cat run by, a shadow, and their husband or wife or friend says, "Oh no, I didn't see that." And so they kind of scratch their head and go along. And it can range from, very mild to more severe, where people are seeing other folks sitting at their dining room, who their partner might not see. And sometimes people recognize that they are having a hallucination, and other times it's harder for the patient to know if that's real or not. So why does this happen? Prevalence of hallucinations in Parkinson's is also probably more than you would think, okay? And we have a breakdown in brain pathways. We have some changes in visual processing and attention processing. And the reason that it's important to talk about these is because we will not, there's no judgment from us. These can be distressing. You're like, oh gosh, what's going on with me? You might feel isolated. You might feel confused. It's important to talk about with your family members as well. Untreated hallucinations, they can become, they can pose a danger sometimes if somebody is wanting to exit the home for whatever reason. And so we need to talk about those as a team and come up with a plan. We do have some treatment options. So we may, like I said, medication adjustment, Parkinson's medication adjustment can be an option. Making sure that we have a good sleep-wake schedule can help decrease both confusion and hallucinations. Adjusting and helping mood can also promote just less hallucinations. And then we also have medications specifically to treat hallucinations. So I talked about a lot of different things and kind of fast. I'm gonna just go over some of these things with you. So I mentioned in this talk, I mentioned depression and anxiety. I mentioned elimination issues, including constipation and urinary frequency, impulsive behaviors, sexual dysfunction, and hallucinations. So my hope today is not that you feel like you're an expert in all these things, but now you know, okay, some of these things are related to my Parkinson's disease, and I should talk to my provider about it because there are treatment options. I really appreciate you kind of feel like we trapped you in here to talk about taboo topics. But I think it's really important, and I really thank you for your attention, and I hope that this talk lets you feel more confident bringing up some of these topics the next time that you come to the office and meet with your provider. So thank you guys.